Hello friend, I am Ajit. Today I am going to discuss one more important drug, that is drug acting on cardiovascular system. So this is a too much important drug for stroke or cardiovascular disease. So the drug that is Telmavas, that is tel Telma, that is indicate Telmisartan, and the Telmisartan, that is the angiotensin angiotensin 2 receptor blocker, that is antagonist, and Vas, that Vas indicate cardiovascular system, and H indicate hydrochlorothiazide. So that is the one diuretics and the drug acting on cardiovascular system. And if you see, that is packaging, that is there mentioned, that is alu packing. So after I will mention what kind of packaging is there for a pharmaceutical product. And if you see the composition of the drug, that is each tablet contain, if you take one tablet, in the tablet you will get Telmisartan IP, means Indian pharmacopoeia, 40 mg, and hydrochlorothiazide 12.5 mg. And there also excipient is there, that excipient is quantity sufficient, or you can say that is quanta sufficient. So what is mean by excipient? Excipient is the other than pharmaceutical substances which is used for because of coloring or flavoring or sweetening agent. So there is excipient, there is that excipient don't have any pharmacological action. And if you see the warning, they are mentioning that when pregnancy is detected, Telmisartan should be discontinued. If any pregnant woman is there, so she should not take the Telmisartan. As soon as possible, she should stop taking the drug, because the drug can causes injury and even death to the. So that pregnancy woman should not take this drug, because that causes fatal damage or fatal injury or fatal death also. So you should not take, means pregnancy woman should not take this drug as pregnancy detected. And one more important things, and you should, when used in pregnancy during second and third trimester. So after I will discuss what is mean by trimester. Trimester means 3 months. So in that, so the drug mainly indication means what purpose the medication is used. That is mainly for hypertension, stroke, myocardial infarction, that is called MI. So what is mean by hypertension? Hypertension means elevated arterial blood pressure. And the drug Telmisartan, angiotensin 2 antagonist, or you can say that is blockers, that is available dose of Telmisartan 20 mg, 40 mg, and 80 mg. And hydrochlorothiazide, that is diuretic, otherwise called water pill. Why it is called water pill? Means urine output is increases after taking the diuretics and lowering the blood pressure. So this is why it is called water pill. And packaging, what kind of packaging is there that is in the drug is, that is alu packaging they are mentioning here. They are mentioned that is alu packing. So what kind of packaging is there, we'll see. Number 1, that is strip packaging, blister packaging, alu packaging, and bottle packing. So what are the side effects of the drug for Telmavas? H, that is fatigue. Fatigue means extreme tiredness, or sinus inflammation in the sinus, and dizziness. And pregnancy trimester, there is 3 type of trimester is there, that is first trimester, second trimester, and third trimester. Trimester means 3 months. First trimester means first 3 months, that is 1 month, 2 months, and 3 months. Second trimester means 4, 5, and 6 months. And third trimester means last 3 months, that is 7, 8, and 9 months. This is all about the trimester of this pregnancy, during pregnancy. So this is the main drug. of choice for that hypertension, and this was the first line drug for mild hypertension, sorry, moderate hypertensive patient. If the blood pressure is more than 160, so that time we should prescribe that time we should give the combination medicine, that is Telmisartan plus hydrochlorothiazide. Telmisartan, that is the angiotensin 2 receptor blockers, and hydrochlorothiazide, that is the diuretics. So that is the drug of choice for that patient.